So we start with the notion that the mind has these two different agencies for the sake of our conversation, conscious and subconscious, and they have different jobs to perform. And the subconscious mind is really the part that we want to focus on because that's the emotional mind. That's the part of our mind that governs many of our bodily functions. Right now, we're breathing, digesting, eliminating, growing hair and nails and all of that, breathing, heart beating. We don't consciously do any of that. All of that happens subconsciously. So if we understand that the subconscious mind influence the functioning of our immune system, and we understand that a proper immune function is crucial for the body's ability to maintain balance and health, then we want to see what has changed. Because if a person was born healthy, it means everything worked fine. And then if someday something changed, what has changed? And for the most part, and I think you talked about it in one of your videos before, there's an accumulation, a compounding effect. It can be environmental components. From my perspective, it's psychological components, mental components, trauma, life events. And over time, we know that they start kind of impacting the way that our immune system functions.
Welcome to the Beljanski Cancer Talk Show, where integrative science and holistic healing come together. I am Sylvie Beljanski, and in each episode, we explore nutrition, lifestyle, mental health, and research-backed approaches to support the whole person through cancer and chronic diseases. Hello, everybody, and welcome back to the Beljanski Cancer Talk Show. My guest today is Avinoam Lerner. Avinoam Lerner is a cancer and trauma recovery specialist, clinical hypnotherapist, and TEDx speaker with over 25 years of experience working with people facing cancer and trauma. Drawing on the psychoneuroimmunology, his Mindful Remission approach helps cancer patients reprogram the subconscious patterns driving stress and immune suppression, addressing not just the body, but the inner terrain in which healing happens. His forthcoming book, Mindful Remission, The Mental Health of Healing, will be published in May 2026. Avinoam, welcome to the show.
Thank you very much. I will remark that the book is called Mindful Remission, but it's Mindful Remission, the mental science of healing cancer.
Very good. Very good.
Thank you.
So, psychoneuroimmunology. I assume growing up, you did not, as a little boy, think, I want to become a psychoneuroimmunologist. Probably you did not even know about the word. So how did you get there?
Well, I wouldn't say that I'm a psychoneuroimmunologist. I am a practitioner whose work, the premise of my work, is grounded in psychoneuroimmunology, which is essentially a field of science that has been with us since the 1970s. And it's the holy grail of, I would say, mind-body medicine in general. And essentially what it is, it's the study of the communication between the mind, which is the non-physical part of who we are, the brain, which is the 3-pound gray organ in our skull, and the nervous and immune system of our body. Medicine has been fascinated with this notion, how does the non-physical part of us actually affect changes in the organic tissue? And for many years, they didn't have the answer, but psychoneuroimmunology came about. We learned that the immune system is responsive. It can be conditioned. So I just taken it a little further and developed a methodology so that we can actually do that and help patients navigate treatment with a lot less fear and a lot more agency so that they can genuinely optimize their results, optimize their outcome, improve their experience during treatment.
I assume this goes beyond cancer patients. Of course, it can help cancer patients, but I mean, the understanding, the trauma, the origin is kind of universal approach to healing, right?
Correct. So I have worked with cancer patients. Almost, the majority of my clients are cancer patients, just because I would say the need is greater in that community. But yes, this applies to any kind of ailment that the body is inflicted with that medicine cannot necessarily find an organic component or a very clear physical or physiological answer for why things the way they are. When the reality is that we're 50% physical and 50% non-physical. If you cut the body open, there's no little person in there. So what is this self? And I mean, that's a much bigger conversation, but I would say that generally speaking, if we are 50% physical and 50% non-physical, and we take the 50% that is non-physical and divide it to mental and psychological, then, even if we just address the 25% of either the psychological or the mental, wouldn't we want 25 more percent odds for healing and recovery? Of course we would. Anyone would. And that's why it's really important to do this kind of work.
Yeah, I've always seen people who heal really recover from cancer as those who have a positive mind and try to understand why they became sick in the first place, because conventional medicine never addresses that. They only look at the tumor and try to destroy a tumor by every means they have, and but they don't look at the person, and they even dismiss the damage they are doing to the person while destroying the tumor. So at what was the moment when you realized that the mind was not just a supporting player of the healing, but was really central to this phenomenon of healing?
Sure. Well, again, I've been doing this for 25 years, and you get to see some patterns over time. And I've seen people who have done everything right medically, right? They did what their doctor told them to do. They showed up to appointments and scans, and they still struggled a great deal. And then there were those who thrived, those who actually got better outcomes on every marker. And I was very curious because it wasn't necessarily about a person's strength or size or genetics, or it was the internal environment in which they were healing in that made the difference. And we know that through the Human Genome Project. We know that, at first we thought that there's a gene per a condition. Then we realized, well, it's a combination of them. And then we realized that some of them are turned on and then some of them turned off. And so we had to ask the question, what turns certain genes on and off? And the answer is complex, but amongst the contributors are the mental and emotional environment that the person is operating in. If we're exposed to stress in a chronic level, we will consistently trigger the stress response, as you well know, and that will lead to inflammation, to suppressed immune function, and that renders the body vulnerable to carcinogens and other disease agents. But if we learn, which would never really, and that's kind of mind-blowing, right? We were never really taught how to live. We were taught how to survive. And that's a whole different approach to life. But when we learn how to engage with this part of ourselves we call the mind, mainly the part we call the subconscious mind, because that's the emotional part and the part that regulates most of our body functions, including immune function, then we can get results. I would say the mind is not just a player in this constellation, it's actually the stage upon which healing happens.
So you have developed this specific protocol called Mindful Remission. Can you walk us on what does that actually look like for a patient coming to your practice?
Well, so we start with the notion that the mind has these two different agencies for the sake of our conversation, conscious and subconscious, and they have different jobs to perform. And the subconscious mind is really the part that we want to focus on because that's the emotional mind. That's the part of our mind that governs many of our bodily functions. Right now, we're breathing, digesting, eliminating, growing hair and nails and all of that, breathing, heart beating. We don't consciously do any of that. All of that happens subconsciously. So if we understand that the subconscious mind influence the functioning of our immune system, and we understand that a proper immune function is crucial for the body's ability to maintain balance and health, then we want to see what has changed. Because if a person was born healthy, it means everything worked fine. And then if someday something changed, what has changed? And for the most part, and I think you talked about it in one of your videos before, there's an accumulation, a compounding effect. It can be environmental components. From my perspective, it's psychological components, mental components, trauma, life events. And over time, we know that they start kind of impacting the way that our immune system functions. So mindful remission in a nutshell is a practical, goal-oriented, result-driven methodology to engage the subconscious mind so we can address the patterns that we know through this research called psychoneuroimmunology are suppressing our immune function, so we can allow the immune system to perk up and do what it's designed to do, which is to eliminate any abnormalities in the blood.
And so tell me more practically, how does it work? I mean, you are speaking with a patient, you let the patient speak like a kind of a psychoanalysis. Tell me more.
Sure. So the therapeutic vehicle, if you will, is the subconscious mind. We want to access that part. And to do that, we need tools that are a bit different from traditional therapy. In talk therapy, we sit and talk about our problem, which is useful. But essentially, we are talking to the conscious mind, which is rational and logical. For example, it's the educated mind, the part of your mind that is listening to me right now. And that part is important, but it's like a guard that's standing in front of the vault in a bank to check your credentials, your password, if you will. So in Mindful Remission, we use a tool called hypnotherapy or clinical hypnotherapy and a specific protocol to essentially bypass that guard so that we can get into the vault and affect change to certain patterns that the mind perceives as harmful, limiting in some ways. So oftentimes trauma, oftentimes things we have learned, a way we have been conditioned. And when we change the nature of these patterns, for example, you learned that you're not worthy enough or good enough or smart enough or something enough. If we can change that, diffuse that pattern from negative to even just neutral, it will no longer kind of pulse within us, no longer reclaim some of this energy that we need for healing and repair. That energy will be freed for the body to use for healing and repair. So essentially, when a person comes into the office, well, we can do this either in the office. That's a more intensive program. I'm happy to talk about that a little later. Those are 3-day intensive program. Then there's the online aspect of it, which is an 8-week-long program. But essentially, we use hypnotherapy as the therapeutic vehicle to access the subconscious mind. And unlike in talk therapy, where tell me what you think about it, we're trying to analyze you, fix you. Here, we don't do any of that. Here, we let your mind bring forth what it believes is at the root of this. And because of the nature of the hypnosis work that we do, there is a level of immersion that happens. A person moves forward, inward, and the inner story unfolds in such a way that you're fully immersed in it. So in talk therapy, you're both the participant, but you're also the observant because you think about what you say, you feel. Here, you're fully immersed in your own story. And that level of immersion creates a bridge between the past and the present, which is what allows us to change things that happened back then and there as if they're right here and right now. Ultimately, we're changing the meaning of what we believe that happened. And when we change the meaning, which is the root cause, we change the effect. So you change the source, you change the effect.
When you are facing cancer, the choices can feel overwhelming. Conflicting advices, endless options, and very little clarity. At Maison Beljanski, everything begins with science. For decades, molecular biologist Dr. Mirko Beljanski studied how specific plant extracts interact with cancer cells, work that continues today through independent research and real-world use. Maison Beljanski offers carefully formulated supplements inspired by that research, along with targeted support for immune health, cellular resilience, digestion, detoxification, and overall wellness. You will also find educational books, organic teas, personalized health coaching, and wellness programs designed to support the whole person, not just a diagnosis. This is not about quick fixes. It's about informed choices, thoughtful formulations, and supporting the body alongside conventional care. Explore the products, the research, and the resources at maisonbeljanski.com, because when science leads, wellness follows. Absolutely. When it comes to cancer patients, I mean, there is very often a lot of fear, and it's the first thing that they feel when they receive the diagnosis, and it's sometimes a very overwhelming fear. How do you work with that fear and transform that in a way that may help support the healing process?
Sure. So fear is a very big component. I mean, it's just the most natural response that I would say we can have when we hear those three words, "You have cancer," right? I mean, fear is certainly there. And fear is there because we perceive what we just heard, the news that nobody wants to hear. We perceive it as a threat. And it's a threat because we have prior knowledge, prior information. We heard about it, we read about it. Maybe someone in our family has gone through this. And so we immediately connect the dots, and we're in the grip of fear and the stress response. So oftentimes what we have to do is, so there's mainly two reasons why someone steps into fear. One is all about perception. The other is all about belief. The perception is that what we're stepping into is going to be difficult, dangerous, painful, overwhelming, all of those things. That's the perception of what we're going through or what we're stepping into. But the second component, the belief component, is really where the heart of it is, because we don't believe, essentially, when you feel fear, it's because you don't believe you have the inner resources to cope. We do things in life that are very challenging and very demanding. We all have been doing these things, and we faced all kinds of things, but we tend to give cancer, illness such as cancer, this extra weight. If we have the flu, or even when COVID went through, we dealt with it. We didn't give it the same amount of weight as we do with cancer. So the point is, we have to change either our perception of why we perceive this as a threat, or cultivate better inner resources, right? So that we can meet this moment with grace, with ease, with certainty. And
yeah, and there is nothing probably more powerful than finding that you have those inner resources and that you don't need to be in fear.
well, if you knew with absolute certainty that you will get through this, would you have the same response? No. So this is what we have to work around. Our mind is pulling so-called evidence from somewhere. Where does this evidence come from? Obviously, we have come a long way through medicine. Medicine can buy us time. It can give us an advantage. It can even take care of the physical aspect altogether. And we may step into remission, which hopefully is what we're looking for. But that doesn't mean that the fear went away, right? Because the nervous system is still dysregulated. The mind is not fully settled into the notion that the storm has passed. So regardless of what goes on physically, we have to understand what each of our minds is doing so that we can address the root of it and change that. When we change the meaning, that happens by itself.
Absolutely. We are one, I mean, mind and body, and we have to take care of both. So for a patient, I mean, who is going with at the hospital with, I mean, as regular appointments at the hospital, is maybe going under chemotherapy, how do they incorporate your practice and the work they are doing with you? Is they are doing that at the same time? How does it work for practically?
Sure. So most people engage this kind of work once they have received the diagnosis. Ideally, this kind of approach, addressing the seed patterns at the subconscious mind, ideally, it's something that we will do in advance as a preventative approach. But most of us will only do this kind of work when we have to. And so, yes, when people are either just started treatment, just received their diagnosis, it doesn't matter what stage, and people say, well, I'm in an advanced stage. What can this do for me? And I
Yeah.
like to tell them that the subconscious patterns don't care what stage you are.
Yeah.
And resolving them, addressing them at the root will always bring about relief and improvement.
Yeah.
Right?
And it's really very, I mean, unfortunately, people start looking at other means beyond what the hospital is saying only when they are very advanced stage, when actually they should start really the research before the diagnosis or at the latest on day one of the diagnosis, and try to understand
Definitely.
what they kind of support and healing process they can get, and start educating themselves as much as they can as early as possible, not when the official medicine is almost rejecting you because you have finished everything the insurance would pay for. I mean, this is not the way to go. Still, I mean, there is hope, and still, I mean, other modalities can give you some relief, but the better you start to educate yourself and take advantage of what there is around you. And as you just said, I mean, learning how to live when you are still healthy and doing well, what better way to look at life? I mean, that's a kind of way to make the most of what life has to offer to you, rather than poisoning years with having a negative narrative in your head that you are not able to solve by yourself. So I think that what you are doing is great, and I love the idea of this approach. Is it a work that people are doing one-on-one by you? Do you organize retreats or some kind of group things? Tell me more. When cancer enters your life, the questions don't stop at treatment. You start asking why, what else, and what more can I do to support my body? At the Beljanski Foundation, we believe cancer care deserves deeper answers rooted in science, not in shortcuts. For decades, groundbreaking molecular research by Dr. Mirko Beljanski explored how specific natural compounds selectively target cancer cells while sparing healthy ones. That work continues today through independent research, education, and global collaboration. At beljanski.org, you will find evidence-based resources, expert-led conferences, books, and conversations that explore integrative approaches to cancer and chronic disease alongside conventional care. Whether you are a patient, a caregiver, or practitioner, this is the place to learn, to question, and to think more expansively about healing. Visit beljanski.org to explore the research, attend upcoming events, and connect with the Beljanski community. Because informed choices begin with credible science.
So I'm a one-on-one person. I think this kind of work is very intimate. And so, there's nothing wrong with retreats. And then obviously there's tremendous value to group work and such. And I actually am inspired to do that in a retreat format, because there are things that we can absolutely do as a group. But I find so much meaning and value in connection with people and holding them in this, very tender place. It's just very, very intimate and personal and rewarding and transforming. I mean, it's life altering. I'd like to say that our mind is like our operating system. We all carry now phones in our pockets, and every now and then we get this prompt, security update is required, and we don't give it too much thought. We just press the button. And the reason there's an update needed is because there's more information, more stuff to consider that the operating system needs to compute for. But we've never really given ourselves this kind of upgrade or update of our operating system. Not really. I mean, some of it happens naturally when we grow up, but I'd like to say that, today, 2026, most of us operating system mentally and emotionally is still Windows 93. And that's present us with a significant challenge. Think about it. Relationships. We like to think that we're having relationships as adults, but we're really inner childs in an adult body, emotionally at least, trying to figure it out because no one taught us how to do maybe relationships, how to go after what we want, how to be our full self, how to feel good about ourselves. These things that we never really learned from the ground up. So the question is when? We're so busy living life. Most of us will never give ourselves this upgrade until life itself says that it's time. And then we're so stubborn that we will just push everything aside. We'll ignore, we'll plow and continue to work through and push, and we'll suppress. But we know that that which we resist persists. So eventually life finds a way. Illness is a very powerful, it shuts us down. It forces us to look inside and to make these upgrades that we so desperately need.
For the average person, how long for how long do they have to work with you? How many sessions, how many months is the average person work with you? Yeah.
So there's two ways to work. The in-person work is a 3-day intensive. That's all it takes. It's 15 hours. But the way that these 15 hours are kind of segmented is that the first day is half of that time. So the first day I get to work with one person for 7.5 hours straight. And we go very deep down the rabbit hole. And the reason this is necessary is because of how the mind works. The mind doesn't want to change. Even if the mind is holding on to stuff that isn't perhaps the most healthy for us, the mind prefers comfort over confrontation. So we have to kind of make use of the opportunity. Once we find how to access the mind, we make sure that we utilize this amount of time to go as far as we can. So that's day one, 7.5 hours straight. The second and third days are half days, so a 4 hours day and a 3.5 hours days. And that gets us to about 15 hours. The change or the transformation, I want to make sure that people understand this is not some psychological practice. You feel it in the body. Your nervous system feels regulated. Finally, your body can finally exhale. You feel settled. You feel lighter. You feel that you have a new lease on life, a deeper connection with yourself, because you no longer have to manage these inner conflicts that you have tended to your entire life. And most people find all of a sudden that they've spent decades in guilt, decades in shame, decades in fear, decades making themselves small, minimizing their pain, feeling disconnected. And so when something clicks back into place for them and they feel, maybe for the first time in a very long time, who they are, it's like, well, I'm going to get emotional, but it's
This is so much powerful than years and years of therapy that people sometimes are going through with very little results, actually. And who would not love to take 3 days off just for having such a transformational experience? That's amazing. So for people who want to reach out to you and sign up for this kind of transformational experience, how do they do that?
or they just need to Google my name, Avinoam Lerner. There's 2 of them in the United States, only 2 of us. One is me, and the other happened to be a very big shot Hollywood producer that produced all the Rambo movies. I'm not that. And I do often get calls with people pitching right in, and I'm saying, I'm sorry, you got the wrong one. But if people just Google my name, Avinoam Lerner, I've written.
Tell us a little bit more about, for those people who want to have a 3-day with you, where are you located in the US?
I'm in Boston, Massachusetts. Yeah. So the in-person is one option. And then there's the online, which is an 8-week-long program, which is more like a coaching program. But we are able to do some hypnosis over Zoom. I originally created these 2 as one unit. So the in-person is like surgery and the online is like rehab. But I don't want to decide for people what they need to do. I want them to step into their agency. And if they want to do one and not the other, that's perfectly fine. The Mindful Remission program is a very big toolbox with tools and practices that are proven over the 25 years of doing this work as effective as promoting change in real time. You talked about therapy, and I'd like to say about therapy that if you're driving a car, conventional therapy is like wiping the windshield clean, right? You want to see the road better, and that's important. But if you have an issue with your engine, if your engine is leaking, you really need to pull the car to the side. You need to lift the hood and look under the hood into the engine block, find the faulty part and replace it. And that's what this kind of work does. So we can do it in person, we can do it online, but it's really just, I want to make sure that people understand there's real therapeutic work to be done here. This is not some magic formula and also I want to make sure that people understand this is not here to replace medical treatment, but essentially to do the one thing that medical treatment cannot, and that is address not the physical body, but the person living in this physical body. Doctors are trained in treating the tumor or the physical aspect of cancer, but they have no training. It's not their scope of practice. Immunology, even though it's been around for more than 50 years, most oncologists, if you ask them, they don't know what this is about.
Exactly. And that's why thank you so much for coming to speak to us about it. So tell us a little bit more about your book and what people should expect when buying your book.
Sure. Thank you. So the first book that I've written, it's called The New Cancer Paradigm, Mobilizing the Mind to Heal the Body. That was published in 2012. So 14 years ago. I'm not a writer. I didn't want to write another book. But this book, which is called The Mindful Remission, The Mental Science of Healing Cancer, woke me up in the middle of the night and forced me to write it. I literally fought the idea, but it's an incredible resource for anyone facing illness such as cancer. It's a massive toolbox. It's essentially a workbook and a framework, if you will, all at the same place. So this is coming up in next month, in May 2026. And it's very exciting because it's, if someone doesn't want to do the work with me personally, if they want to try to do work on their own, until now, they didn't know how to do that. There are many, many books that tell you what you need to do, but no books that shows you how. The Mindful Remission book is really that kind of a book. It's a workbook, so you can, each and every one of us can benefit and get amazing results, transformation in their healing and recovery.
Thank you for giving us this kind of wonderful tool.
Thank you so much.
Thank you. Ladies and gentlemen, this was Avinoam Lerner, and it has been a privilege to listen to you, and we're very grateful for your knowledge and your willingness to share and to help us become better people, to make a better world around us.
Thank you
Because
so
in
much.
the end, that's what it is about.
Yes. Thank you so much, Sylvia. I appreciate it. Yeah.
Thank you so much. Thank you for listening to the Belgian Cancer Talk Show. If this conversation supported or inspired you, please follow the podcast, share it with someone who may benefit, and leave a review to help others discover these integrative perspectives. For more resources and to see what we offer, please visit beljanski.org.